All right, Mississippi has the third highest rate of chlamydia in the country and the highest rate of gonorrhea in the country. Why do you think that is such a big issue here?
Overwhelmingly, in our state, what I've identified are factors that would lead to us having the highest prevalence of STDs, sexually transmitted diseases. One of the number one reasons is we have decreased access. More people in Mississippi per capita don't have health insurance and they can't afford to go to the doctor. So if you have someone that suspects that they might have a sexually transmitted disease, there's less likely a chance that they'll go and get evaluated because it's going to be expensive. Another factor that's very, very impactful is our core religious beliefs and the fact that we tend to judge one another in the event that somebody might think that they have a sexually transmitted disease. In a lot of cases, people feel embarrassed to go and be evaluated for a sexually transmitted disease. And this would also lead us to not going out, getting evaluated, getting diagnosed, getting treated, and continuing a risky lifestyle because we just don't know.
Dr. Quinn, what do we need to do here in Mississippi to bring those numbers down? You've talked about some of the problems, some of the reasons we have them. What are some concrete things we can do to drop those numbers?
Well, one thing we can do is programming such as WJTV, where we let people know what's going on, such as this. And in this particular case, what we want to do is inform our community. If you have a sexually transmitted disease and you don't get diagnosed, then that sexually transmitted disease could lead to complications. Some of these complications, for instance, could be scarring of the fallopian tubes of a woman with scar tissue where she could become infertile, where she can't have children one day. A person could become septic. Other problems could be HPV, undiagnosed, could lead to vaginal cancer. So the first thing we have to do is continue to inform our community. The second thing we need to do is to try to extend health insurance to as many people as possible, make it more accessible. And lastly, we have to do sensitivity training with our medical facilities, such as here at our clinic. What we do is we talk to all our new hires and let them know if someone comes in and they want to talk about sexually transmitted disease possibilities, we have to make them feel comfortable and not judged. And we have to talk to them in a private area in a way that they feel that they can let us know what's going on, and also reassure patients that anything that they tell us is confidential. We are very serious about that, and it really helps when you have these conversations with the patients.
All right, very good information there. Dr. Quinn, thank you again for sharing your expertise with us, and we will have you back before too long, I know for sure. Thank you for being with us.